Morning, everyone. First, I want to thank GSI for sponsoring this event, for hosting the event, as well as our sponsors for investing in our conversation this morning. We appreciate your generosity. My role this morning is to talk from the small business perspective and give you some examples of things we're doing to provide fringe benefits that promote employee health, both fringes that cost and things that don't have a dollar tag attached to them. Our organization has 80 employees. As Rich said, we're scattered throughout the state. Our corporate value around this topic is to sustain workplace excellence and personal health. It's important that we have healthy employees. We used to be in the Broadview Dairy here a few years ago, and one of my employees described it this way: happy cows produce happy milk. And it's important that we have a workforce that is able to sustain productivity. Excellence in the workplace matters to our bottom lines. And so that's our corporate value. Over the last 3 years, we have averaged 97.6% attendance rate for all employees. We only have full-time employees. They're all salaried, exempt employees. As a result of our continuous attempt to survey employees, it's resulted in a couple of selections to these 100 best places to work lists over the last few years. And it's due to employees giving very strong feedback about their employment and workplace experience. Some of the benefits that promote healthy employees at a cost include the typical medical, dental, and vision. We sponsor that for the employee. I just want to put a plug, since one of our corporate sponsors is our dental carrier that we worked with for many, many years. I was in a meeting recently with a major health provider, and their CEO told me that of all the people that come for medical attention, healthcare services, both insured and uninsured patients, 30% of them seek medical attention for dental-related problems. In my experience in working with employers, our business is an employment and training workforce development organization, so we broker the relationship between the employer that's seeking talent and the person that's looking for a family-supporting compensation package. And in working with employers, we often get into this topic about fringe benefit packages that they provide to their employees and ways they might enhance that. One of the things that in my experience in working with hundreds of small businesses over the last 31 years is that they see medical insurance as a required part of their fringe benefit, but looking at dental coverage as a part of their tier 1 package is not always in the thought process. So if you're a small business person, I'm just going to make an unsolicited sales pitch. Consider dental insurance as a part of your fringe benefit package for your employees. Some of the things we also do include reimbursing employees for health and wellness stuff. So if you want to pay your registration fees for Bloomsday, Hoop Fest, other fun runs, we'll reimburse you for that. Dance classes and exercise classes, we've recently expanded that to include reimbursing people for pre-approved purchases of exercise equipment. So if you want to buy a mountain bike, set of golf clubs, snowboard, we will reimburse you for those costs. We've got a sick leave program, we provide not only sick leave hours, but we give employees two-hour blocks of time every month to go to their doctor for a checkup, eye exams, cleaning, teeth cleaning, those kinds of things. Things that don't cost include a 4-day work week. We have had a 4-day work week whenever we can control the employee's schedule. Since 1979, it works out great. When everybody else took a 3-day weekend this past week, our employees took 4 on the weekend. For those who work 4 days a week, we have a work week of 6:30 to 6:30. You can start as early as 6:30 a.m. or as late as 8 a.m. You get done. That's for people who have child care needs. The daycare might not stay open as late, so they need to get there. So people can flex We've younged up our organization in the last 5 years, and in 6 months' time, we've had 6 babies delivered. Every January, we provide people with an inventory of the value of their fringe benefits, and when you see that bottom line into the thousands of dollars, people really value what they have. Other things that promote health include financial health, and so in the next 2 years, we're going to have experts come and talk to us about retirement planning, estate planning, those kinds of things that help them stay ahead of the financial game. I'm going to end there. Thanks.